Welcome to British Biomedicine Institute. Today we will explore why black fungus, mucormycosis, is only targeting COVID-19 patient in India. Hospitals across India have been reporting several cases of mucormycosis, a rare fungal infection affecting patients who have recently recovered from COVID-19. Mucormycosis is a very rare infection. It is caused by exposure to mucor mold, which is commonly found in soil, plants, manure, and decaying fruits and vegetables. It affects the sinuses, the brain and the lungs, and can be life-threatening in diabetic, or severely immunocompromised individuals, such as cancer patients or people with HIV/AIDS. Doctors believe mucormycosis, which has an overall mortality rate of 50%, may be being triggered by the use of steroids, a life-saving treatment for severe and critically ill COVID-19 patients. Steroids reduce inflammation in the lungs for COVID-19, and appear to help stop some of the damage that can happen when the body's immune system goes into overdrive to fight off coronavirus. But they also reduce immunity and push up blood sugar levels in both diabetics and non-diabetic COVID-19 patients. It's thought that this drop in immunity could be triggering these cases of mucormycosis. Patients suffering from the fungal infection typically have symptoms of stuffy and bleeding nose, swelling of and pain in the eye, drooping of eyelids, and blurred and finally, loss of the vision. There could be black patches of skin around the nose. Some common types of a fungal infection include skin infections like ringworm, nail infections, deeper cutaneous infections following trauma, breach in the skin with subsequent fungal implantation and growth, sinus infections, and deep lung infections. The fungi can also affect the gastrointestinal system, renal systems, and can cause a full-blown infection, resulting from the entry of fungus into the bloodstream. In some cases, doctors in India say patients have lost their vision in both eyes. And in rare cases, doctors have to surgically remove the jawbone in order to stop the disease from spreading. One way to stall the possibility of the fungal infection was to make sure that COVID-19 patients, both in treatment and after recovery, were being administered the right dose and duration of steroids. The disease is not contagious and doesn't spread from one person to another. Bronchopulmonary lavage and pathological examination for fungi are must in order to incorporate appropriate treatment. In tandem, medical management with antifungal drugs, namely injection liposome amphotericin B, needs to be instituted. Older form amphotericin deoxycholate is significantly nephrotoxic. However, the liposomal cousin is safe and effective. Posaconazole tablets/suspension and intravenous forms are available and are used in lieu of amphotericin, if the latter is not tolerated by the patient. Following several weeks of intravenous medication, depending on the response, the patient is put on oral posaconazole sustained release tablets for several months. Isavuconazole is also an alternative drug that can be used. Drugs are stopped after clinical and radiological clearance of the disease. During treatment, judicious use of steroids, keeping blood sugar levels under control, antibiotics, and other antifungal drugs need to be done. These infections are very lethal, and if not treated, most will not make it. The mortality ranges between 25 to 90%. Once the infection spreads into the brain, mortality is very high. Hence, a lot of importance is given to early diagnosis and prompt institution of treatment. Thank you for showing interest in British Biomedicine Institute Skilled Nano-Degree Program. Hope you have gained a lot of information through this presentation. Please share, like, and subscribe our unique medical channel. Good luck.